The most prevalent chronic health problem in children may surprise you. Actually, it's tooth decay.
Let's go back out live to News 13's Victoria Dunkle, who has a way to help change that. And Vic, we're actually saying the tooth decay is a bigger problem than even allergies or asthma.
That's exactly right. A lot of parents think, well, the most common chronic illness in a child is something like asthma because of we hear so much about it. But it's tooth decay, and that's really important for us to realize because when your teeth are hurting, it impacts your entire life. Now, Brittany Clark is a registered dental hygienist here at Great Beginnings Pediatric Dentistry, and you and I were talking about how important it is for us to think about babies and dental health, right?
That's right. The University at North Carolina at Chapel Hill actually established this program, and it's called the Baby Oral Health Program. And so it just really encourages parents to bring their child to the dentist by their first tooth or first birthday. And so it's really important that they bring them in at this early age so that we can talk to them about ways to prevent tooth decay.
All right. Well, we're going to look at a little bit of video of what it's going to be like, because if a lot of parents go, well, my baby's so little, they'll squirm and wiggle. You actually shared some video of what it's like and what's going to happen when they come to see you. What are you looking for in a one-year-old baby?
In a one-year-old baby, at this first appointment, is very educational. So we go through this iPad slide and we talk about different things on here, like why do baby teeth matter, the importance of baby teeth, teething, habits that they may have, and also emergencies.
And back out here, you've actually showing this is what you're going to show me as a mom when I come in.
Exactly. When you would come in, we would show you these slides: cavity progression, feeding practices, snacks, healthy snacks, not healthy snacks.
And that surprised me too, because I always thought raisins were a good healthy snack, but it actually sticks to the kids' teeth. So we have to be aware of that.
Raisins, dried fruits, granola bars, things like that are very sticky for a child.
When can I get in here for this free seminar?
You can come in for the free seminar. Actually, we're hosting one today, and that's going to be at 10 o'clock this morning. And we're also having one next Monday at 5 o'clock. And
there's more information on both of those seminars and other ways that you can get a head start on making a huge difference in the life of your child's oral health when you go to our news links at WLOS.com. Coming up in our next half hour, we're going to take a look at some surprising sources of dental injuries that impact kids from an early age all the way through their growing years. Live in Asheville, Victoria Dunkle, News 13.
Well, in our health alert this morning, we are trying to keep your children's teeth healthy.
News 13's Victoria Dunkle is giving us some tips preventing tooth decay during Children's Dental Month.
This time we're talking about the importance of making sure we protect our kids' teeth from injuries and accidents. And for that, we're going to talk to Dr. Chambers here. And we were actually talking about this whole month is dedicated to really paying attention to our kids' teeth. But we need to do this on a daily basis. What are some steps to take to protect our children from dental injuries?
Well, if you're talking about the different age groups where you see dental injuries, the 2 to 3-year-old age group and the 7 to 9-year-old age group are when you see most dental injuries, and they most occur to front teeth. So around the house for the toddlers, we recommend that some of these things like tub faucet covers, edge covers and corner covers and electric socket covers that can prevent your toddlers. And obviously if you're in a car, being in the car seat's important.
Absolutely, and that's important on so many levels there. You mentioned another age group that really you see another spike in these types of injuries. Was it the 7 to 9-year-olds?
7 to 9. That's
what happens there?
Well, a lot of these young folks are getting involved in sports at that point in time, and so they have new permanent teeth erupting in. They're very big, and so we encourage all kids to wear mouth guards during that age group in sports because it'll help protect against dental injuries. And you would think some sports like soccer actually has one of the higher incidence of dental injuries. Baseball, obviously you don't see as many in football because they do wear mouth guards.
So we need to take a lesson from the football players and
Right.
other sports. Go ahead and wear those protective gear for our teeth. What are some of the advances in repairing these kind of injuries and preventing any permanent, lasting impact from them?
Well, it's important if you're in the primary baby dentition to be evaluated early on because those injuries can affect the development of the permanent teeth. So we want to make sure that you're seen early and that if it's a tooth that needs to be removed or a nerve treatment needs to be done, that's done early on. And then with permanent teeth, you want to be able to get in early so you don't lose the nerve of the permanent tooth.
Lots of steps that we can take to make sure our kids have the best smiles and the healthiest dental health possible. For all the details on the special seminars that are going on tied to that, go to our website, WLOS.com, and click on News Links. Live in Asheville, Victoria Dunkle, News 13.